discuss the difference between food allergies and food intolerance, how to identify an allergic reaction, how to manage it, and much more on the next episode of Ask the Doc, No Appointment Needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, I'm Dr. Scarlet Constant, board-certified pediatrician and founder of Constant Care Pediatrics. Welcome to Ask the Doc, No Appointment Needed, the show where you send in your questions and I will answer them for you in real time. Let's get started as many questions are coming in. The first question comes from Claire. I'm a new parent with my baby only 9 months old. When it comes to food allergies, what are some of the foods that I need to be aware of when feeding my baby? Well, Claire, that's a great question. At 9 months of age, I'm assuming that at this point you've already introduced some of the most common vegetables and fruits to your baby. By 8 to 9 months of age is when we start really introducing proteins and different foods that tend to have allergic proteins. So here are some of the most common allergic protein foods. The most common would be soybeans, tree nuts, and peanuts. Now, at 9 months of age, you could absolutely introduce peanuts and tree nuts and any type of soybean product to your child. The caution that we have is at this age, peanuts or other nuts are still choking hazards. So we don't actually recommend giving it in its natural form, but if there is a product that has peanut butter, let's say, or maybe some type of peanut oil, you can absolutely introduce it to your 9-month-old, but yes, with caution, as those are some of the most common allergens. Now, I don't want you to get confused with tree nuts versus peanuts. Peanuts are legume, and peanuts are not the same as tree nuts, which are cashews, macadamia, walnut, pecan, and so forth. Those are all part of the tree nut family. And having an allergen to one does not mean you have an allergy to the other. Another couple of common allergens are milk, eggs, and wheat. Now, milk is really not introduced until 12 months of age, and that doesn't have anything to do with the allergic properties that it may have. It has to do with the fact that cow protein blocks the absorption of iron in the gut. So we usually don't like babies to start cow milk until they are about 12 months of age. Now, before 12 months of age, if a baby is actually breastfeeding or even drinking formula, yes, there is cow milk protein there. And yes, there could be an allergic reaction to that milk. But at this point, by 9 months, you would already know if your child had developed an allergy to milk. And how do you know if your child is allergic to milk? Well, usually the first 2 to 4 months of life, if they are ingesting, again, milk products from mother's milk or from formula, cow milk protein, they would start to develop some blood in the stool. So you'll have bloody stools that will get progressively worse until the milk is removed from the diet. Eggs and wheat are other common allergens, and we advise that when you're introducing eggs, again, usually this is by 9 months of age, we actually recommend that you introduce the egg yolk first without the white. And this is because while eggs are very commonly allergic, it is actually the egg white that is the most commonly allergic part. So we say introduce the yolk. You can make a scrambled eggs with just yolk, or maybe boil the egg and give the yolk and introduce that as well. So if you introduce that and there's no reaction, then the next step would be to introduce the entire egg with the egg white to see if there's a reaction there. And if there's no reaction, then you're safe. But again, eggs, the most common allergic part of an egg will be the egg white. Wheat is another common allergen, which is why we introduce wheat products later by 9 months of age. And also, there are a couple more allergens are fish, shellfish, and sesame. Again, fish and shellfish are 2 separate entities. Shellfish are the crustaceans. So you could definitely introduce your whitefish, your tunas, your salmon, and things like that. Proceed with caution, of course, but you can definitely introduce that. And then if your child does not have a reaction to that, then you can go ahead and try the shellfish, which would be your lobster, crab, shrimp, and other crustaceans. Sesame, of course, is in many products, as well as sesame oil, so you'd want to proceed with caution there. Well, I hope that helps. And again, you have so many choices when introducing food to your 9-month-old, but just please remember to proceed with caution and give the same foods for about 3 days to a week just to confirm that your child does not have a reaction to those foods. So it looks like we have another question coming in, and this question is from Tammy. We are a family with 2 boys and 2 girls, but both boys have food allergies, but the girls don't have any food allergies. Are boys more susceptible to food allergies? That's a great question, Tammy. There is not any evidence that will support a difference between susceptibility and gender. In your family, maybe we can study them, but there's no evidence that supports boys are more susceptible to girls. There is definitely a genetic predisposition with allergies. And actually, we like to say that allergies come in a triad, which is asthma, allergies, and eczema. Why don't we take a look at this video and I'll answer the rest of your question. Stephanie wants to know, how does a food allergy happen? Is it already there or does it develop over time? Well, so this is, what I was discussing earlier. You have a predisposition to allergies, and there is an allergic triad that we refer to, where if a child or family member has a history of asthma or a history of eczema, otherwise known as atopy, then there is more of a likelihood that you have an allergy to food or to environmental allergies, just an allergic disposition in general. And this is a genetic predisposition. And so over time, with introduction of allergens, then the actual allergic reaction starts to develop over time. Let's take a look at this video for some clarity.
Does your child have a food allergy?
How does food allergy happen is the first question.
Dr. Avni Joshi says one theory has to do with babies who have the skin condition eczema.
The food gets introduced through the skin, and that causes an aberrant immune response. So instead of the food being tolerant, you start recognizing the food as an allergen.
When that food is introduced into diets later, the babies have already developed antibodies against that food.
Kids start having itching and throat closure. If large amount is consumed, they can have vomiting, they can have head-to-toe hives, breathing difficulty, and anaphylaxis.
Anaphylaxis happens when your immune system identifies a substance such as peanuts as foreign. This triggers cells called mast cells to release chemicals that cause many symptoms, including dilated blood vessels, constricted airways, intestinal problems, and even death. For the Mayo Clinic News Network, I'm Vivian Williams.
I hope that helped answer your question, Stephanie. Looks like we have another question coming in now, and this question is from Josh. My daughter has really bad allergies to a few different foods, and she is a real picky eater. Will she outgrow these, and if not, is there a cure? So Josh, that's a great question, and that's really a twofold question, because children that have severe food allergies or food allergies to multiple foods, we find it very difficult to offer them meals. We're restricting a lot from their diet. A lot of the staples in the diet that they typically would want, we're actually removing, which becomes very difficult, I know. Depending on what your daughter is allergic to, I would be able to tell you if she will outgrow it or not. There are some food allergies that you just don't outgrow. And yes, there are some that over time you will eventually outgrow or withstand. With that said, she's also a picky eater, which makes it even more difficult. I totally understand. So what I would say to you is to try to be as creative as you can. This kind of includes just looking at different replacement ingredients for different meals and helping her just kind of achieve a taste that she likes or consistency that she likes while using an ingredient that she's not allergic to. So I would say to be creative, look through some cookbooks. You can also speak to your allergist, because your allergist actually would be very helpful in creating diets and routines for your child that she can adhere to. They They work very well with you in the office to help create like a catered diet that will work for her, give her the nutritional value that she needs while not introducing allergens. Thankfully, there is a lot out there now as far as restaurants and schools where they have a lot of creative meals and meal prepping that really help address these issues with a lot of the children. So it's a lot easier now than it used to be before. Good luck, and I hope that this helps you. If you would like to send in your questions and you don't remember how, take a look at this video.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We're back, and it seems that there are more questions coming in. This is a pretty hot topic. This question is from Anders. You have been talking a lot about food allergies, but my daughter's issue is what the doctor called environmental allergies. What are those and what triggers them? Great, so yes, there are food allergies and environmental allergies. Environmental allergies, also known as respiratory allergies, are allergies that we develop toward things that we find in the environment, such as dust, mold, pollen, trees, grass, cat, dog, cockroach, believe it or not, and many more. And it's interesting with the respiratory allergy panel, which is what the name of the test is, a test for these environmental allergies, we actually test according to the area that your child lives in. So there are environmental allergies specific to the environment that you're in. For example, we run tests on allergies to oak trees here in South Florida, whereas in other areas of the state, they will test for different types of trees that are not found here. So these environmental allergies, again, they are things that we find in the environment. And the reason why we test for that is because we'd like to know what is triggering your child. And if we can eliminate it, we will try to do that. Now, eliminating maybe dust or grass or trees is a little more difficult than eliminating dust in your environment. Dust we can control, we can clean, we can change filters in the house, but grass and trees and things that you might find at school are a little more difficult. What triggers them? Being exposed to them in abundance. So if your child has an oak tree allergy, then yes, being outside where there are oak trees or going to school where there's an oak tree right in the front is going to trigger her allergic symptoms. The good thing with that is that treatment is a lot easier than with food allergy. With food allergies, you have to just remove those foods from the diet, unfortunately. And if you can't outgrow those allergies, then you can never have those foods again. With environmental allergies, thankfully, there have been a lot of remedies that have come about, such as oral immunotherapy, immunotherapy by injection, and that's basically giving small doses of the allergens via injection so that the patient will be desensitized to this allergy. So it's really great, if you have a kid that's allergic to dogs, but you know that you're a dog family and you're always going to have dogs, or they're always going to go to their friends' houses that have dogs, you can actually get immunotherapy toward dog and eventually become desensitized to the dog allergy and be able to be exposed to dogs again. So environmental allergies, while they are quite serious and quite a bit of a nuisance, you do have the option to get treatment towards it. So that's a positive. I hope that helped answer your question. Okay, it looks like we have another question coming in right now. And this is from Carly. Why do my daughter's allergies seem to get worse at different times of the year? Well, Carly, I'm assuming your daughter has environmental allergies, which is what I was discussing before. And environmental allergies, there are, certain dust particles, pollen, trees that increase during different times of the year. When, in spring, when everything is in bloom, then you're going to have stronger allergies to the plants or flowers that you're allergic to. Or if your child is allergic to grass and they just cut the grass and there's like maintenance going on around the house or the school, then the allergies get worse. So it depends on the climate, it depends on the weather, it depends on what your child is actually allergic to, and I'm assuming it would be environmental. And it depends on, where your child is. If they have a dust allergy and it's winter time and there's more dust accumulating in the house, then their allergies are going to be triggered. So it all depends on what your child's being exposed to. So it's very important to know what they're allergic to so that you could eliminate or at least decrease the exposure to your child. In case I can't get to your questions or you haven't been able to submit a question during the show, please go to Ask Hanna, and here's how.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.
Okay, so looks like we still have questions coming in. This question is from Sherry. My son's friend has bad allergies and sneezes all the time. Are allergies contagious? And can he get sick from his friend sneezing? Well, Shari, allergies are definitely not contagious. That does not mean you shouldn't practice proper hygiene when sneezing and rubbing your nose and blowing your nose. You know, absolutely, there's still a mechanism of spreading germs. And while your son's friend might be sneezing due to allergies, he still has bacteria in his nose and on his hands. So he should definitely cover his mouth and nose when sneezing and wash his hands because he still can spread germs. Okay, looks like we have another question, and this one is coming in from Adriana. My child has bad food allergies, and I always have an EpiPen with me. My question is, when should I use it? Well, Adriana, that is a great question. I think that a lot of us, even in the medical community, think that an EpiPen is really the last resort in a really bad situation, like throat closing up, can't breathe, wheezing, use the EpiPen. And, you know, that's actually not the case, depending on how severe your child's allergy is. And that's something that you should definitely discuss with your allergist. But if your child has serious food allergies, truly you should use the EpiPen upon ingestion. That means once you find out that your child did actually ingest and a food that they are allergic to, you don't even wait for symptoms, you just go ahead and administer the EpiPen. And I will reiterate, even for myself, I did not realize that. I really did always think you need to wait for bad symptoms, a patient to be in distress, maybe not being, not responding to Benadryl, and then go ahead and give the EpiPen. But that's really not the case. If your child has severe allergies, please give that EpiPen as soon as you have a confirmed ingestion. And there is an EpiPen, and there's also the AccuView. And so those are two different injections that you'll use. And you should always go over that with your allergist before you leave the office. They teach you how to use it effectively, how to remove the cap, where to hold the pen, and how to administer. And it's important to know that you don't need to remove the child's clothes and inject on plain skin. You can always inject over the clothes, over jeans, over regular pants. If there's a bare leg, great, but if not, it doesn't matter. What you want to do is just get that injection in as soon as possible. You're usually going to go on the outer part of the thigh and the outer part of the upper thigh, and on the outside you just inject and you hold for 3 seconds and then release. And remember, this is upon ingestion, confirmed ingestion, outer part of the leg. You don't need to remove the clothes, go right through the clothes, hold 3 seconds and then remove. And this is something that you and family members should practice, and again, should go over with your allergist as soon as they prescribe that EpiPen. They usually show you in the office with a tester how to use it, and everybody should demonstrate that they know how to use it appropriately. I hope that this helps. So it looks like we have another question coming in, and this question is from Steve. I've heard a lot lately about keeping my kids away from processed foods. Can you explain what foods are processed and what are healthy foods? Well, Steve, the answer is both. there are healthy foods that are processed foods. You know, I think that processed food gets a really bad name. I think that we think of ultra processed foods, and those are foods that have added sugars, added sweeteners for flavor, maybe artificial flavors. But processed foods are almost all of the foods that we eat, right? We don't just grab food from the farm, pick it up from the farm and then just eat it. They're either dry packed, they're canned, they're frozen, and that doesn't necessarily mean it's a bad thing. Canned vegetables are still healthy. Frozen vegetables are still healthy. They are processed because they are not in their original form. They're packaged, they're transported, they're sent to us, which just has to be because this is the way of life today, but they are not unhealthy. So I encourage you to make sure you differentiate between processed and ultra processed. And yes, ultra processed foods are not healthy. You should not eat anything that has added sugar or added artificial sweetener or added flavor or artificial flavors just for taste. You know, we really need to try to stick to, you know, our vegetables and fruits, and they're, you know, of course they're packaged, but if they are not, if nothing is added to them to alter their taste or to make it sweeter or better, then those are going to be your healthy options. And I would definitely still go to those quote unquote processed foods. Those are still great health options. Sure, we'd love to have organic foods as organic as we possibly can get, but that's not terribly realistic. So as long as it's not ultra processed, then I think you're fine. If you'd like to still send in your questions during this episode, take a look and see how to do so.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, so send in your questions. We still have some time. Here we have a question right now coming in from the Facebook page, and it's from Nanette. What is the difference between food allergies and food intolerance? Well, that's a great question, Nanette. Food allergies are this is actually an immune-mediated response that your body has to foods, to the proteins of these foods. So this is what we call an IgE-mediated response. Your body is reacting to it. It's calling on your histamines, your mast cells. All of your inflammatory markers are actually having a reaction to this food product and will not tolerate it. And this will cause anaphylaxis, or an anaphylactoid type of reaction. That's redness, swelling, hives, vasodilation, and ultimately wheezing or throat constriction. These are all IgE-mediated responses. Food intolerance is when your body is limited or missing an enzyme needed in order to break down this food product. So you're not actually allergic to it, you're not responding to it, you're not reacting to it, you're just having difficulty breaking it down and metabolizing it in the body. And depending on what this intolerance is, you might even be able to take the enzyme in a pill form so that you can actually process the food product. So intolerance is missing an enzyme and a difficulty metabolizing the product. Allergy is an IgE-mediated response and actually having a reaction to this product. I hope that wasn't too much science, and I hope that helped. Okay, looks like we have another question coming in. This is from Lawrence. My son is very active and he loves to eat and eat and eat. Even though he is busy, I know he risks putting on weight. What are some healthy snack options? So this is a great question because, you know, our young children, especially young boys that are athletic and active, they really do love to eat. And they do require a lot of calories. They require 2,500 to 3,000 calories depending on the age of the child and the size. So it's really hard for us to watch them eat so much and not get worried about weight gain. So I will say, of course, healthy meals, if he does enjoy eating 3 healthy meals throughout the day, and then the snacks in between, you want to give high protein snacks so they don't feel so hungry. You know, a lot of times they'll eat and then feel hungry maybe 15, 20 minutes later. So you want to give good protein rich snacks, such as snacks that have peanut butter or almond butter, protein bars. You could give them smoothies that have fruit and have like a little bit of protein there, oatmeal snacks. Granola mix is really great as well. These are all like dense snacks that will really help carry him through to the next meal. I hope that this helps. Guys, if you want to send in more questions, please go to the Ask Hanna app. This is all we have for today. We don't have any more questions. We don't have time for any more questions. So thank you so much for joining us. My name is Scarlet Constant. Again, founder of Constant Care Pediatrics. Thank you for joining, and I'll see you next time.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.